More than 24 people have died and hundreds globally have been sickened by the Wuhan coronavirus. And now officials in Texas are investigating if a college student is sick with the same illness days after a case was reported in Washington state. Melissa Rainey has the latest.
But the patient is in isolation.
A suspected case of the lethal Wuhan coronavirus is being investigated in Brazos County, Texas. Texas A&M is confirming a student of theirs may be infected after a trip to China.
The patient had traveled to the area of concern, developed mild symptoms after returning.
The school said in a statement, quote, officials have described the immediate health risk to the campus community as low. County health officials say the CDC is working to confirm or deny the case.
If it's a confirmed case, then contact tracing will be initiated and any at-risk person will be put on a monitoring system. And so we'll watch for symptom development.
There's now hundreds of cases reported worldwide, sparking fears of an international public health emergency.
This is, though, an emergency in China, but it has not yet become a global health emergency.
The president of the American Airlines Flight Attendant Union is calling on their airline and others to institute immediate emergency measures. Despite those fears, the White House says Americans shouldn't panic.
We are monitoring this situation in real time. The president has been briefed and remains consistently vigilant in making sure that this doesn't spread throughout our country.
I'm Melissa Rainey reporting.
43 people are now under observation in Washington state after having close contact with the first patient. The Senate will be briefed by the Trump administration tomorrow morning. A cancer patient near Boston is told he would have to wait for his badly needed surgery. The reason? A shortage of surgical gowns, which is affecting hospitals across the nation. The FDA has asked hospitals to stop using a specific Cardinal Health gown worn by surgeons because of quality issues identified at a contract manufacturer's facility. Cardinal Health says at this time it cannot guarantee the product is sterile. The potential for surgical delays came as a shock to families already struggling with a difficult diagnosis.
What do you do with that information? You're told, oh, we need to start this now, and then 5 minutes later you're told, oh no, we can't do that.
In other parts of the country, like Western Pennsylvania, hospitals have canceled and rescheduled elective non-emergency surgeries because of this issue. There's no word yet on when the problem will be fixed.